morning. We might is a very precious person from the U.S. David Song from the Georgetown University, and he's our adjunct professor. So he's very our big brother to our department. So please welcome.
Thank you. Well, Professor O, really appreciate coming back home to see all my old friends. And I was going to talk about the aesthetics of breast reconstruction and the blurring lines between reconstructive breast surgery and cosmetic surgery. But Professor Choi wanted me to talk about leadership. So I'm going to talk a little bit about leadership. And if we have time, we can talk a little bit about some of the things that we're doing at Georgetown University. So, can you all hear me okay? Should I speak in Korean or should English is better?
English is better.
Okay, all right. So this is a very famous sort of saying from Lao Tzu, the journey of 1,000 miles begins with one step. It's very cliche, and I'm sure you've heard it before, but this is a statement that I really live by because it seems like a long journey, but you can't get there without that first step. So thank you to Dr. Choi for inviting me here. I'm actually here for personal matters. I have a sick relative, but this timing worked out perfectly to be able to be with you guys today. So talking about leadership, Professor Choi wanted me to discuss sort of the leadership as plastic surgeons in academic health systems. I think the problem with our specialty is we're so focused and we love operating so much that we see very few plastic surgeons leading healthcare systems, at least in the US. And I think there's a tremendous opportunity for plastic surgeons, the way we think, the way we problem solve, to be able to translate that into healthcare administration and managing not just a department, but an entire hospital and a healthcare system. In my opinion, hospitals now more than ever need leaders who bridge specialties and that are not just siloed into one specific thing like surgical oncology or cardiac. And in my opinion, once again, plastic surgeons are very uniquely poised to serve that role, because if you think about what we do every day, even today, you're going to leave here and you're going to work with oral surgeons, you're going to work with breast surgeons, you're going to work with neurosurgeons, you're going to work with orthopedic surgeons. And we understand that, and it's a really a unique perspective that we have that no one else has, right? If you think about it, think about neurosurgeons. They're working on the brain and the spine, and that's it. Orthopedic surgeons, they're just working on the bone and want to get to the golf course. And we're so, healthcare, particularly in modern healthcare systems like Seoul and in the US, has become very much siloed and very much super subspecialized. I mean, even in microsurgery, there are microsurgeons and then there are super microsurgeons. So you're starting to see just this incredible specialization of healthcare. And yet, in my opinion, once again, you guys, everyone in this room, are positioned, whether you know it or not, to become leaders within healthcare systems across the world. And it's under-recognized, the strength that we have. And I'll show you some examples that hopefully will convince you that beyond plastic surgery, there's a whole nother world, because the interplay, and I was just talking this morning about how surgeries Asan has gone down by 30% or 40% because a lack of anesthesiologists. And so how do we bridge that gap, and how do we problem solve during crises? This is an old article, but I just saw this recently, is plastic surgeons in high-level leadership roles. It's published in 2020, and they talked about a couple of people, and here's the algorithm. They looked at 99 leaders of 66 institutions in the United States, of the top 66, and 32 were surgeons in chief, only one plastic surgeon at that time. 67 were CEOs, only one plastic surgeon at that time. Many had decades of experience, many had an MBA, obviously a strong publication and a fellowship record, and a proven track record of national leadership within societies. Then how did they become the institutional leader? The problem is, if you look at all these 99 leaders, this was back in 2020, there were no plastic surgeons that were in the C-suite of a healthcare system. And I think that has changed, and it's continuing to change. And I'll give you a couple of examples of what's happening since this paper was published. And I feel that we are, once again, incredibly ready and poised to be leaders within academic health institutions. Let me pause for a moment and talk a little bit about the fact that if plastic surgeons, if you look at neurosurgeons, their organ is the brain and spine, right? Orthopedic surgeons, their organs are bones. You know, head and neck surgeons, obviously head and neck. Breast surgeons, it's the breast. Plastic surgeons, what is your organ? Anyone, what do you think is your organ? There is none, right? So in my opinion, our organ space is in the space of problem solving. So we're constantly working with other specialties to solve a problem, a clinical problem that has so many different touch points. And I think that because of that, our organ, and Rod Rourke talked about this a long time ago, is that our organ is problem solving. And so that translates so well to healthcare management and academic healthcare systems because there's a lot of problems, as you guys experience here, but us in the US with a new leadership, and there's a significant cut in Medicaid and Medicare coming down the road, we have to solve problems. And I think we, every day, you guys working with Professor O and Professor Choi and all the Professor and all the wonderful surgeons here, you guys are problem solving every single day. So let me just give you 3 examples since then of plastic surgeons who have become high-level institutional leaders, not just department leaders, but institutional leaders. So Robbie Pearl, not really academic, but he became the CEO of the Permanente Medical Group, which is Kaiser Permanente, one of the largest healthcare systems in the United States. He was formerly the president of the Mid-Atlantic Permanente, based in DC, and he led over 10,000 physicians, 38,000 staff, obviously nationally recognized, and he was a clinical professor at Stanford. He didn't really have the academic sort of background with the publication records, but he had incredible management skills, and he's an outstanding communicator. He has a podcast, and he talks about healthcare. I've had a chance to meet and sit with him and have dinner with him, and the way he thinks is very much in line with how we think every day as plastic surgeons, solving problems, looking at things from a different perspective, and utilizing tools and utilizing multiple different touch points within our colleagues to better and solve that problem. Bob Murphy, who's probably been here, maybe, right, a few years ago, past president of ASPS, good friend. He's recently become the executive vice president and chief physician executive for the Lehigh Valley Physicians Group. So all the physicians, not just plastic surgeons, in charge of over 1,300 physicians and advanced practice care providers, and really leading a large healthcare system of physicians within the Lehigh Valley, which is in the Pennsylvania, New Jersey area. I learned a lot from Bob. He was a very prominent plastic surgeon, aesthetic, but also did reconstructive, and was a president of ASPS 2 terms before me, and we've gotten to be good friends. And so we share a lot of sort of the common themes of wanting to lead, but at the same time understanding what our strengths are and what our weaknesses are. And I'll talk about that too in a minute. And then everyone knows Andy Lee. Andy Lee was former chair of the Department of Plastic Surgery at Hopkins. He's now the executive VP of academic affairs. He's the provost, and he's the dean of the UT Southwestern School of Medicine. Again, within the medical school, he is the top guy, and he's really been a transformative leader, and previous chair of the American Board of Plastic Surgeons, previous president of the American Association of Plastic Surgeons, was an incredible problem solver, really innovator of penile transplants, obviously hand transplants, and everyone knows Andy Lee. Again, a problem solver, understanding what the problem is, and really utilizing all the different touch points that we as plastic surgeons have to harness that to be able to solve different problems. So in my opinion, all these have shared leadership traits. They have vision, there's a sense of empathy, excellent communicators. It's hard to be a good leader in this day and age, whether you're coming from Europe or Asia or the US. You have to be a good communicator. You have to be able to tell a compelling story that sticks, that resonates with the people that you're trying to communicate with, whether it's residents, visiting fellows, colleagues, or your superiors, to be able to share and create a visual story that sticks. That's an art form. It's something that some people are born with, but most of us, including myself, had to practice over and over again to try to build a way to convey my thoughts to the folks in the audience without being threatening, being funny, but also being memorable. That's an art form, and it takes a lot of practice. And if you guys have some time, there's a lot of YouTube videos on how to be a better communicator, how to be a storyteller. And really good leaders are storytellers. They tell a story that sticks with you, that moments of turmoil or crisis give you comfort and provide clarity. And I want to follow that guy wherever he's going, or that woman wherever she's going. And that really comes down to the ability to communicate in an effective way. Effective leaders are good collaborators. And that's part of our DNA, right? As plastic surgeons, we're constantly collaborating. Professor is working with some breast surgeons that are very good, and maybe some breast surgeons that make the flaps too thin. And that's how do we collaborate with a different skill set of our colleagues. Some are excellent, some need help, and most are somewhere in between. And they bring to the table their own baggage, right? So they have a different, we all know challenging personalities. I want you to pause for a moment and visualize the most difficult person don't say it out loud because Professor Choi will be upset, but the most difficult person that you've had to work with in the last 6 months. Think about that person. Everyone have that person in mind? Yeah? Most challenging, makes you feel bad. Now, take for one moment and think for a moment, what may be happening in that person's life that he or she is bringing it to work, right? You don't know if they're going through a divorce. You don't know if their child is sick. You don't know if their mother or father is ill. They have financial issues. That all comes to the foray of your interactions with that person and taints and colors every little thing. But you don't know that. So I have this concept that API, okay? Whenever you're dealing with someone, assume positive intent. Think about that for a moment. Assume positive intent. You have someone that you're interacting with, horrible. I would say 99% of the people that we work with, if you assume positive intent and not say things like, oh, what a jerk. I'll say it in Korean. That if you assume positive content and turn that around and give that person the benefit of the doubt, it opens up a whole new world of incredible relationships with very challenging people. So go back to that challenging person that you had in your mind and think about assuming positive intent. And I share this with you as part of collaboration, which leads to integrity. If you assume positive intent and you understand where that person may be coming from, it doesn't mean you acquiesce your position. It doesn't mean you give up everything. It means that you're managing yourself. So great leaders manage themselves, right? So they understand the situation, they understand the audience, they understand that the other person that they're dealing with that may have a bad day is not necessarily personal. They don't dislike me, David Song, as a person. They dislike perhaps what I'm about to say, perhaps a disagreement of where we want to go, perhaps a competition for limited resources, but it's not personal. So if you manage yourself with the assumption of assuming positive intent in someone else, it challenges you to become, and it catapults you to become a better leader. And I think that's, if you remember nothing else from this talk, think about assuming positive intent. Now, there's some assholes out there. Don't get me wrong. But they're far and few in between. Most people are coming to the table with stress, challenges, obstacles, and personal demons that they're dealing with every single day. Some of us in this room are having really challenging issues. And you don't know that you're conveying that to the people that you're working with. And so if you can manage yourself with integrity and assume positive intent, that's the first foundational basis for great leadership. And of course, all these things lead to strategic thinking and to be able to create a vision, communicate that vision, and then execute on that vision by holding yourself accountable and holding those around you accountable. That's a hard thing to do. There's some good talkers, there's some good visionaries, there's some great strategic thinkers, but to become an effective leader, you have to hold yourself accountable and the team around you accountable in a very gentle, nurturing, and supportive way. It sounds like an oxymoron. Holding people accountable in a supportive way, absolutely possible and extremely necessary when things are tough and tight. So let me give you an example. So we have, I'm a part of this faculty, let's say, and I've noticed that the operations have reduced by 60%. And so there's some extreme suffering and patients that are being, because of anesthesia, lack of anesthesia. So accountability means getting together, creating a vision, helping to prioritize what operations are super important, and then working with the person across the aisle, the chair of anesthesiology, to say, I know you have limited resources, but we need these prioritizations and we need your buy-in. So maybe we're not going to do secondary rhinos unless we do it on a Sunday or Saturday afternoon. Maybe we're going to prioritize medically necessary time-sensitive operations and create a vision and a platform to hold each other accountable. It's a hard thing to do because I want to get my, breast augmentation done and I want to get my this or that done, and yet there's limited resources. And these are the times where really good leadership, through collaboration, integrity, and the ability to communicate, but holding yourself accountable, holding others accountable in a very positive way is so important. I hold others accountable with data. So I'll give you one example of what's happening. We're having some issues with cleanliness in some of our hospital suites. And we've noticed that our environmental services, the people that go and clean the room, may not be doing the best job. We can go in there with different ways to test whether there's still bacteria or contaminants. And let's say about 65% of the rooms are being cleaned properly. Well, if I ran into the door and opened the door of the vice president of facilities and said, you got to fix this, what's going on here? He's going to be very defensive. He's going to back away. He's immediately going to put up his dukes and say, well, what are you talking about? We're doing a great job. I just hired 20, 30 people. But if I said, hey, Tommy, we need to sit. I need your advice on something. Oh, yeah, what's going on, Dr. Song? You immediately equalize that relationship. Say, hey, I want to share with you I know you agree that having a very clean room is important for all of us. Oh, absolutely, Dr. Song. Well, let me share some data that may not be correct, but I want you to understand the possibility that it may be correct, and let's talk about this. We bring out the data and we show that only 65% of the rooms are cleaned properly by these metrics. That's extremely powerful. And how do we do that? Can we meet next week? How can I help you to get this to 95%? How can we help each other? Because we have a shared goal of creating what comes from, and it's really easy in healthcare in the sense that we have one goal, one overriding true north. That's taking care of our patients, right? That's it. Why are we here? Why are you guys in the room? Why are you traveling from all over the world to come and work and understand and learn from these amazing professors? Is because we want to take care of our patients better wherever we go. So if you think about that as the true north and get that buy-in from someone that's not a physician, then you share data and it's very transparent. You walk through the methodology of how we gathered the data. You walk through the fact that no data is perfect, but the trend line is going this way. And then you challenge them and say, hey, let's do better. What can I do to help you? How can I help? What can the physicians do? What can the nursing staff do? What can we all do together? Because it's all about the patient. So that's the ability to hold people accountable and hold a team accountable because you're holding yourself accountable. And again, assuming positive intent. They're not here to be lazy. Maybe 1 in 100 are, but they're here to do a great job to take care of that patient, like you all. And so how do we harness that positive sort of intent and make that more of a standard way of delivering healthcare? That's all about accountability after that strategic thinking. So let me just give you some examples that I have seen as well. But before I do that, I'll talk about the fact that plastic surgeons, once again, we have that interdisciplinary interface every single day. You're going to walk out of here and you're going to work with any one of these people across the whole system, nurses, environmental services, people in the cafeteria. It's very important to remember that you have a unique perspective and a viewpoint and an opportunity to be able to harness those relationships. Systems thinking. If you think about, I don't mean to pick on orthopedic surgeons, they're not thinking about the system. They're thinking about the bone and how to put that beautiful plate on with low profile, and that's it. That's it. We're thinking about form, we're thinking about function, we're thinking about sort of the aging process of after this is done. What happens with the beautiful breast that Professor builds in 20 years? What happens in 15 years with capsular contracture of these new, we talk about this, it's part of our DNA. It's part of what we talk about in clinical forums like this every single day. So we're thinking about systems in each patient on every single moment in time from what we do. And of course, there's innovation that we have helped to lead the way. So maybe for the young folks in the room, but the field of transplantation, the first kidney transplant, I'm sure you guys know this, hopefully you do. The first kidney transplant was done from a twin brother to a twin brother at the Peter Brent Brigham Hospital. And do you guys know who did that first kidney transplant? Murray, yeah, Joe Murray, right? So he was a chief of plastic surgery. So he started the field of solid organ transplantation. So pretty amazing. Microsurgery. I mean, this is, I'm here at the mecca of microsurgery. 3D printing. We just presented a really nice article at Barcelona. I wasn't there, but one of my residents talked about 3D printing models for pennies to practice exposure for the internal mammary system, to practice. I know JW uses 3D printing a lot for other things, for planning, and there's now VSP that has totally changed the way we practice. It's standard of care now. So we have been on the innovation and the cutting edge of that. And then, of course, operational expertise. I'm going to pick on orthopedic surgeons again. They go in there and they say, 7:30, I need to cut this and I need to put this hip in. 12 o'clock, I'm doing this other, and they have this linear way of thinking throughout their day. As plastic surgeons, it's not linear at all. I got to start my case over here, then I'm going to go help JW, do a free flap, maybe a medial sural artery flap, and then JP calls me and says, oh, I need help with, raising a skip flap. And you're trying to manage this matrix of your time throughout the day. And that's the day, Professor is like doing a revision in one room. He's got to wait for the mastectomy in the next room to then do the flap or implant. We're constantly thinking about operational expertise throughout the day. And then we've got to all get done because Professor Song's here. We got to go out to dinner with him tonight. So we got to, figure out how to manage all these things. And that's what we do every single day. You got to think about, this is like incredible training grounds for leadership, right? Operational expertise. So there's so many different pathways. I know in Korea it's very different, sort of rotating chairmanship. But the times have changed incredibly in the US as well. In the past, the best surgeon, the most well-known surgeon, just de facto became the chief or the chair. Now it all really has turned towards understanding who has the best management skills, who has operational expertise, who has relationships, who can manage themselves the best. Because you got to manage yourself in order to manage others, and then that leads to managing the business of healthcare, right? Many have gone on to get business degrees and fellowships. I think if you look at many of the leaders that are plastic surgeons who have now become system or healthcare leaders, they've been national leaders of different societies as well. And then, of course, it's hard to get to have street credibility, to have some credibility in a leadership position if you haven't been academically productive and innovative yourself, right? So that's why I say to folks in the room, how many are medical students? Raise your hand. No medical student. Oh, one medical student. Okay. Where are you from?
From Thailand.
Thailand. Okay. How many are visiting residents from another country? Okay. Most. Terrific. You may not think you're going to be the next leader. Where are you from?
Me?
Yes.
From Barcelona.
Barcelona. Ah. How about you? Where are you from?
Madrid.
Madrid. Okay. So you may not think that you're going to work with Andres Maldonado and become his chair at some point, or Jaume Macia. But this is, in order to get to that position, you have to be excellent every day. So how do you be the best student resident today? Without that excellence on a daily basis, it's hard. But if you make it a practice, that's how you become academically productive. That's how you expose yourself and ready yourself to become innovative. And that's how you, it really is sort of the ticket to ride is being excellent in what you do. So don't let Andres give you a hard time, okay? He was my fellow many years ago in Chicago. The challenges, and let's talk a little bit about challenges. We've done it to ourselves, right? So an academic health system, when your colleagues next door are doing life-saving surgery, taking out big cancers, doing open heart surgery, there's a misperception, and we're part of the problem, right? That plastic surgeons are cosmetic only. And I think that when we lead so you have to know your audience, right? So if you're in a group of, cancer surgeons, cardiac surgeons, thoracic surgeons, and you're talking about, a facelift that you did, it's not going to hit, and they'll remember that. And the part and parcel, the real problem, the weight of the world that holds, in my opinion, holds many leaders in plastic surgery from becoming even further is our reputation. A reputation of being a cosmetic surgeon. There's nothing wrong with cosmetic surgery. In fact, everything that we do, I was going to talk about cosmetic reconstruction, but the thing is, you have to understand your audience. You have to understand what room you're in. And many out in the world are, one, probably jealous, right? Because you get to, plastic surgeons have this reputation of doing some fun stuff and getting paid very well. And not doing necessarily really serious operations. And that's something that we have to continue to fight. How do we balance, how does Professor O as chair balance the importance of cosmetic surgery and how we fit as a department in the greater spectrum of an Asan Medical Center? That's a hard thing to do, but it's a very important thing that we have to struggle with and we have to get better with. We talked about this already. Very few generalists anymore. We've got perforator breast surgeons, implant-based breast surgeons, or plastic surgeons. We've got, cleft lip, soft tissue only, but then we've got pediatric plastic surgeons that do vault surgery. We've got, JP Hong who does lymphedema, only skip flaps. Then we got Peter who does all the ALTs, right? So, and vice versa, I'm making this up, but we've become so super specialized, and that hurts us because it really puts us into the corner and puts us in a silo. I think the solutions are right in this room. You've got incredible people in this room, and those of you from Spain are very fortunate. I know that's why you're here, because these are worldwide leaders in our field, and they are going to serve as your mentors. They're going to give you visibility and involve you in strategy and in the process. So I'm going to go through some of these things and may embarrass a couple of people, but vision, empathy, innovation, communication, interdisciplinary insight, and then of course, integrity is what great leaders all share. So I'll talk a little bit about vision. If you think about what he's doing here, creating and reconstructing a three-dimensional face. This was about 30 years ago. Look at how young he looks. Young and handsome. But the skill set that he's bringing to the table to create this reconstruction is exactly the basis for how we manage the whole hospital or medical center, right? You have to understand the aesthetics, the outer appearance. What's the function doing? What's inside? How does it interplay? What mechanism am I going to do to build up that infraorbital region without disrupting the lower lid and causing ectropion? Those are all interplays and thought processes, and you can exchange those words with how do I run an operating room with orthopedic surgeons and cardiac surgeons, knowing that the thoracic surgeons are really the revenue drivers, and how do I do that without disrupting the thoracic surgeons? It's like, how do I do this without causing an ectropion? So the problem-solving skills are very analogous, and great leaders really require and demonstrate that vision, as JW had. Empathy. So I'm going to tell you a story about Jinsup about 2008. He may not remember this. I was here in 2008, and I helped him do an SIA flap. And he walked me into the room. It was a really young, petite woman. She was probably 32 or 33, right mastectomy, nipple sparing. And she, imagine you're a young woman, 30 years old, and you have breast cancer. And we're all in the room, we're examining her and this and that. We all walk out and he walks back in. I overheard him talking to her and, really sort of calming her down and being empathetic to the situation. What a horrible situation. You're 32, 33. I can't remember how old she was, but she was a young woman. And he went back into the room with the crowd outside of the room and sort of really spent some time, having her understand that he knows how difficult this is. So that empathy, that ability to share and be vulnerable as a leader is incredibly important, right? We all have taught ourselves that leaders are supposed to be strong, but when you're vulnerable as a leader and you're genuine and you're empathetic, it's like secret sauce. It's truly a secret sauce that I hope you guys can harness. And this is what we did together. And then, of course, innovation. I mean, I think in plastic surgery, you think about innovation, the first two letters that come up in my mind is JP, all right? So he talks about innovation, he experiences it, he lives it. He went from not doing any lymphedema, he really diabetic foot, now he's become, a worldwide leader in lymphatic surgery. And here's his skip flap from a long time ago. Think about the innovative trajectory of JP, right? So when I first knew him, he was a microsurgeon, really focused on lower extremity ulcers, and then he's become a true sort of master in lymphatic surgery. The secret is, this is probably Peter's flap. Communication. We talked about communication, and I know Professor Ko is retired, but Professor Ko is like my hero. He's really helped to be the international ambassador for Korean plastic surgery. And if you don't have you guys met Professor Ko, visiting students? This guy is, if you look up the word gentleman in the dictionary, you'll see his picture next to it. He is a true gentleman. The ability to, he's super humble, very humble, and has an incredible way of disarming you to be able to communicate. We went through some really challenging times in trying to create MOUs and helping to build relationships with the Korean society, the Japanese society. So I'll tell you something that maybe most people don't know. The American Society of Plastic Surgeons created a wonderful, lasting relationship with the Korean Society of Plastic Surgeons. And a large part is because of this guy. Behind the scenes, making phone calls, communicating in a very humble but firm way that this needs to be done. After this was done, and the Korean Society of Plastic Surgeons has created a wonderful relationship with the American Society of Plastic Surgeons and become really an international leader, he called me and said, I need you to help me create a relationship with the Japanese society with the American Society of Plastic Surgeons. You probably don't know this. So he was instrumental in making me come to Japan, introducing me to all the right people. And I thought for a moment, why is he helping the Japanese? if you think about the history of our culture, right? Probably his generations and further up, there's not a lot of love between Korea and Japan. And yet he saw a greater vision of Japanese plastic surgeons collaborating with Korean plastic surgeons. And prior to the pandemic and prior to all this crazy stuff that's happening with residencies here, if you think about the Korean Society of Plastic Surgeons annual meeting, there's a large component and from Japan that comes. And in large part, that's because of this guy. His ability to communicate a shared vision and to be highly, with integrity and honesty is something that I admire. And he doesn't get enough credit, but this gentleman is the one that really sort of established and continues and built the foundation for a lot of our early work with the Korean Society as an American Society of Plastic Surgeons president, and then of course with Japan. And he deserves a tremendous amount of credit. And then interdisciplinary insight. I mean, I remember Professor O here as a young, maybe fellow, right? But if you think about what he does and has taken the mantle from Professor Ko and built this interdisciplinary unit to be able to manage speech pathologists, pediatricians, radiologists, ENT, that takes a lot of effort. If you've ever, when you go and work with Professor O and he's doing multidisciplinary cleft clinic, think about all the different components that come for this one patient, and think about all the different personalities that come for this one patient. And to be able to manage an incredibly disparate interdisciplinary team, it is a daily exercise in leadership. He may not realize it, but it's a daily exercise in leadership. So, key message and a call to action. I really feel that plastic surgeons should not just lead departments, but should lead healthcare systems. We have that unique skill set of cross-disciplinary relationships, activity, and precision, right? And then one word I forgot to put in there is accountability. We have to stay accountable to ourselves and to each other. We have to promote mentorship and leadership within our own societies. And again, I'm going to say it sounds like a broken record, but assume positive intent. The person that comes to meet with you, assume positive intent. And if you pause for a moment and say, why is he so upset? It's not you. What's your name? Naeem. Where are you from, Naeem?
UAE.
UAE, okay. So it's a challenging culture, right? If you go back there, there's a clash between traditional and modern thought processes. And someone's going to come to you and maybe is going to be angry. And it's going to make you feel like, whoa, why is this guy angry? But if you pause for a moment and say, he's not angry at Naeem. He's angry at what I may be saying and what shared resources that I may be asking for that he doesn't want to give up. And so, but if you pause and sort of take a breath and assume positive intent, like we all want the same thing. We want to take care of our UAE patients together. Then it really helps to see things and see challenging situations in a different light. Not always, but it's a good foundational exercise. The last thing I'll say is someone told me, it's kind of a funny saying, if you're not at the table, you're on the menu, right? So I'll pause for a moment and tell you about a really crazy story. In Chicago, about 25 years ago, there's a hospital called Cook County Hospital. Have you guys heard of Cook County Hospital? It's a very famous sort of trauma county, public hospital. Limited resources in Chicago. And at the table, literally at the table, the Cook County Commissioner brought all the chairs of the departments and said, we've got a problem here. We need to cut, $3 million from the budget. How do we do that? At the table, everyone was represented. Plastic surgery wasn't there. The plastic surgeon at the time, good friend of mine, Mimis Cohen, was doing a facelift. I knew that, maybe no one else did, but everyone at the table said, well, we need to do something. How are we going to save $3 million for next year? One guy his name is Gonzalez, he's a hand surgeon, orthopedic hand surgeon, did his own free flaps. He's like, well, I could do all the free flaps. We don't need plastic surgeons. The cardiac surgeon raises his hand and says, the sternal wounds, I could do that. I don't need that. The general surgeon raises his hand and says, hernias? I could do, flaps. I could do rectus flaps and advancement flaps. so on and so forth. ENT said, well, what about the big mandible reconstruction? Oh, I could do those. I'll call Gonzalez and he can help me do the free flaps. Long story short, he wasn't at the table. He ended up on the menu. They cut the whole department and hired one guy to do pressure sores. It turned, I mean, it's horrible. It turned a county hospital that had tremendous history and poof, gone. So if you're not at the table, you end up on the menu, okay? But don't wait for that seat. You got to create that seat at the table. You've got to be a part of the decision-making process. How do you do that? You have to think about volunteering. You have to insert yourself because you want to learn. Professor Park's going to be like, I need to learn how to understand supply chain. So let me be involved in how we make purchasing decisions for Asan Medical Center. Professor Saul may say, hey, I need to be involved more in how operational flows in the operating room happen and how blocks are allocated to different services and how that rubric is important. It's so easy to go back in for Professor Pak, for Professor Saul to work on their free flaps and to do great work, but we're missing the opportunity to help run Asan Medical Center. I'm just going to share with you my journey, and this was not purposeful. I didn't sit there when I came, as you came from Madrid. I didn't say, oh, I'm going to be a chair someday. I'm going to be a leader. I had no idea, to be totally honest. So I graduated residency 2000, did a microfellowship in 2001. It was very unusual, but I became the chief of plastic surgery at U Chicago at a very young age. I think the chair saw something in me that I didn't see in myself. And so then they sent me to business school in 2009. I became the vice chair of the department and then the associate dean for the medical school. And then 2017, I was recruited to Georgetown, became the regional chief there and executive director for a service line. And then I became surgeon in chief for the whole system back in 2020. And then recently I became vice president of medical affairs and chief medical officer. I'm still running the operating rooms. I didn't put that on there, but this is sort of my journey. It's a different journey than everyone else is going to have in the room. There's some elements here that I think are shared with other leaders, perhaps. The MBA totally changed the course of my career. I didn't know anything about finances. I knew nothing about operational management. I didn't even know what the word supply chain meant. I thought it was a chain, but I had no clue. But that was transformative in my career to be able to use all the concepts that I learned in business school, and I think about things in surgery and in hospital management very differently today, and because of the tools that I was taught in business school. And then I was fortunate to become president of ASPS. I was the chair of our board of plastic surgery in 2022, and then I just recently stepped down as chair. My term ran out as chair of the RRC, which is we review all the residency programs in the country. And so again, bringing to the table all those sort of toolkits and lessons that I've learned, but I still lead with managing myself, assuming positive intent, and building relationships. Leaders build relationships. That's all you have to remember. Build relationships. It's sometimes more often more important to have someone feel good about your relationship than being right. Think about that for a moment. You can be right, but if you come and say, I'm right, and you've destroyed a relationship, what have you achieved? So it doesn't mean to let someone be wrong, but it means to understand the timing of the situation. Being right is not necessarily going to help you build relationships. This is a good lesson, by the way, with your spouses. I'm always wrong with my wife, always wrong, and I know that. But building that relationship, and you can go in and say we can have multiple examples in our lives where you're putting your fist down. I'm right, and yeah, you may be right, but you've lost that opportunity to build a relationship, and you've lost a little bit of trust because you slammed your fist and said I'm right, and then the next thing you say, I told you I'm right. Yeah, you were right, but what did you do for that relationship? You've completely eroded the trust and the sensitivities of that relationship. I see a lot of smiles. We do this every day. Think about it, folks. Every day. And it's easy in this room at 8 o'clock. How much time do I have, JW?
So
5 more minutes? Okay.
5 minutes.
Yeah. It's
okay?
easy to be, thinking this way when it's in the morning, you have a cup of coffee, but it's hard when it's stressful. When it's 2 a.m. and someone's trying to bump your case, that's when this is really important. So this is why you have to build muscle memory now. So I'm going to skip through this because I think that we can have some Q&A, but I want you to think about what you bring to the table and help creating that table, how we can support each other as rising leaders, and then where are the untapped opportunities in Barcelona, in Madrid, in the UAE. There's tons. We just have to see things differently. This is just some old pictures of different leaders. Here's Murphy. Look at this guy. He was like 20 years old back then. JP. This was sort of helping to build relationships with our societies. JW again, when he had really dark hair and was, we were much younger. And Chinsup, this was a few years ago when we were, I don't know where we were, but I don't know, but probably some alcohol involved. This is one of my favorite pictures. Professor Ko is just such a hero of mine, and I think if you get to know his history here and what he's done, and I hope I've shared with you some of the amazing things that he's done for this Korean society. He's a true gentleman. And that is the end of my talk, and I'll open this for questions.
These lectures, how you became the top leadership position for a long time. So we met in 2007 or 8, right?
Yeah.
So since that time, whenever I met the David Song, actually, if he made any comment in very controversial situation, most audiences and participants tends to be agreeable with his final suggestion. He's very powerful in persuading the people. So that's what I'd like to hear and then share. And actually, I would like to all of you, hear how he can manage the not only himself but also the colleagues. So thank you so much, David.
Thank you, GW. We really appreciate it. I know you guys have a busy day today. Who's operating? Kure, what are you doing today? That's great. I know.
Any other question? Actually,
questions
you can
for me?
ask a question.
Yes, Professor O.
I think that absolutely your lecture inspired many of us because there are many future leaders in this room. And actually, I'm just a very beginner for the leader. I want to be a really good leader. But when I just after becoming chief of this department, JPyong gave me a book. The title was The Radical Candor by Kim Scott. And maybe he want to be like that kind of leader, but every day I struggle between becoming a boss and becoming a leader. But in my opinion, becoming a boss is easier for me.
Yeah.
But how do you balance and how do you weigh out which part weigh more like your excellent leader? So
that's a great question. To be honest with you, I'm still working on that. I mean, it's situationally different, right? So if you're working with Peter and Dr. Pak and John, and they are not sort of going the same direction, it's easy to be the boss because they'll react like that. You can't do that with your nurses or with your cleft team. You just can't. It's a very different set of communicating and a different style of approaching the problem based on the situation. And again, when we're tired, it's easy to bark out orders. Oh, go get this, get the next patient. But you got to remember, it's not, you have to remember every situation who your audience is. And that's the key, I think, the key sort of filter for us to, sometimes it's important to be the boss. Most of the time, it's better to lean on relationships to then become leader. and it's a balancing act every single day, multiple times a day. You're going to go in the operating room potentially today, and you need to be the boss because someone's bleeding. But then you come out into clinic. If you carry that boss mentality into clinic, and you're now working with pediatricians and speech pathologists and audiologists, you can't be the boss. You got to be a relationship builder. And the ability to switch back and forth seamlessly and effortlessly takes a lot of practice. And in my opinion, that's really what the manifestations of a good leader are. It takes practice. Some people do it faster and better, but you have to be both. You have to be the boss and you have to be the leader. You have to be a visionary. You have to be a relationship builder, all at the same time, based on what the difference is and what the situation calls for. So what I do, even to this day, when I came into this room, I'm looking, and that's why I ask, where are you from? UAE, Barcelona, Madrid, where are you guys from?
Barcelona.
Barcelona as well? What about you?
Bilbao.
Lisbon?
Bilbao is Spanish.
Oh, it's Spanish as well. So you want to know who your audience is. Every single time you have a moment or a different situation, you want to know who the audience is. It's easy. When I'm in the operating room with Peter and John, that's my audience. It's easy. You know?
Take a look at this side.
Yeah. Yeah, you guys are all from here, right? So where are you from? Thailand? Thailand. Yeah. So it's especially in Asian cultures, and maybe my advantage is I'm both Asian and also American. It's so much easier to be the boss because it's a very hierarchical society. But remember, that's not a sustainable strategy. Bosses get fired. Leaders help to build. So you have to be both. It's a great question. That's something I struggle with. Someone asked me the other day, what's your leadership style? My leadership, I have many, depending on the situation. The common denominator is understanding the situation. That's where you apply different leadership styles to different situations. So if I'm working with people that are mopping the floors, they're making minimum wage. They barely could bring food home to their families. If you walk in there and say, I'm Professor O, clean this, clean this, clean this. They may do that today, but tomorrow, look at Professor O, what a jerk. Not that you are, but you understand. So you walk in that room and you understand, oh my gosh, I'm working with someone that's not a surgeon, someone that's minimum wage, maybe having a hard time even bringing food to the table. What motivates them? Everyone gets motivated by pride in what they're working on. So you say, hey man, you did a great job today, Tommy. Phenomenal. I have this guy who works at my hospital, older gentleman, and he was kind of a mediocre cleaner. And every time I see him, I pull him aside, Tommy, you're the hardest working man I see here. Oh, thank you, Dr. Song. His leader the other day, he doesn't even know I talked to Tommy. Said, something happened with Tommy. He's now working so much harder because you've inspired him. And it's a very different way than inspiring these guys or inspiring your colleagues or inspiring Peter. Peter doesn't need inspiring. Sometimes Peter just you need to be the boss, right? I'm sorry, Peter. I like to pick on Peter. I've known these guys since they were a resident, so it's good for me to pick on them. So, but great question. Thank you, guys. 뭐 이런 거까지 필요 없는데. Thank you, guys.
1, 2, 3. 1, 2, 3.
And this week in Korea, we celebrate the Teacher's Day, so we prepare something for you because you are the teacher of our department.
Oh my goodness! Thank you, guys. Thank you. Okay.
Actually, the David is an official adjunct professor in our department.
Yeah. What kind of benefits do I get? Free lunch?